This first exercise is called a pelvic floor positioning exercise, and the goal here is that muscles work the best when they're in alignment, in correct alignment. And so here we're trying to get the muscles of the pelvic floor over the diaphragm, and what that does is it creates a strong canister effect. If you imagine a clamshell, if your pelvis is stuck out behind your diaphragm or your rib cage, it doesn't work as well. So what we're going to do is bring those two together and one over the other, which makes the muscles stronger. Then in that position we're going to try to use the muscles, because that's the goal, is to find these pelvic floor muscles and use them in order to make them stronger. So here we have Janet laying on the floor with her legs on a stool. You can use any sort of chair at your house that is about 2 feet off the ground. Okay, so the first thing we're going to do is set her up into a 90-degree position at the hips and at the knees. So here, Janet, just pull your feet in a little bit closer. There we go. So now we have a nice 90-degree angle here and here, here and here. Okay, so then I'm going to have her put a ball between her knees that we're going to use to put a little squeeze on. If you don't have a ball, don't go out to the sporting goods store and buy a ball. What you can do is get a towel from your just a bath towel and roll it up and go ahead and squeeze that between your knees. Okay, so here we are, Janet. So I want you to just give a light squeeze on the ball, just a light squeeze. You don't have to crush it. And then what I'll have you do is you're going to gently push your heels down into the stool. It's just a gentle motion, and allow your pelvis to curl up underneath you. What you'll feel is that your back gets flat into the mat. Do you feel how your back flattens out into the mat?
Yes.
Okay, so
definitely.
Perfect. I'm going to go ahead and relax for a second. I'm going to show you what you don't want to do and what a lot of people tend to do. Is push your heels hard into the stool and raise your bum off the ground. See how there's all of a sudden her back is up off the mat? We don't want that. So go ahead and relax. Let's do it right again. A nice little gentle squeeze here. Yep, pushing and then curling up your pelvis and getting your back nice and flat. Do you feel that?
Yes.
Perfect. Okay, you're going to hold that position this whole time, so don't let that go, okay? Now what I want you to do is put your hand up towards your mouth. That's going to just create a little bit of pressure when you breathe out, okay? So take a gentle breath in, and I want you to breathe all your air out of your lungs, like you're blowing up a big balloon. Blow, blow, blow. You're going to see how her abdominal muscles are getting active. Her rib cage is dropping down. Do you feel that? Do you feel your pelvic floor a little bit? Perfect. Now I want you to hold that nice and strong as you take a breath in through your nose. So your pelvic floor stays strong, your abdominal muscles stay strong. You're not going to be able to take a big breath in. Good job. Now big exhale through your mouth again. You'll feel all those muscles get really tight again. You're going to feel your pelvic floor squeeze together and pull up towards your pubic bone. You're going to feel your abs get strong. Hold for about 3 seconds. Now take a gentle breath in. Don't let that go. Perfect. Exhale. We're going through this. We're going to do 4 to 5 breaths here. So that was, I think, breath 3. Good. Hold tight. 1 more breath. Good. All that air out. Get all that air out. Good. The more air you get out, the stronger those muscles are going to activate. And go ahead and relax. Were you able to feel your abdominal muscles engage? Good, because these are core exercises. And were you able to feel your pelvic floor squeeze together and pull up towards your pubic bone? Great.
Definitely.
So that is a pelvic floor exercise, as well as incorporating the other core muscle components that are used with the pelvic floor. It all works together. Now, one thing that I didn't mention before, but I want to mention now is, as you can see, these exercises are done on the floor, and that's usually the best place to do them. Sometimes we have to understand that it can be a little bit hard to come up off the floor. And if you think that might be the case for you, the best thing to do is make sure that you set up near something sturdy like a couch, or an ottoman or something in your house that you know that you can use to assist you to get up, if that's something that you're concerned about. This exercise is a hip abduction exercise. So it's working the muscles of the backs of your hips. But these muscles all work together, so we're also going to incorporate the pelvic floor as well in this exercise. So here what I want you to do, Janet, is make sure that your hips are stacked up one over the other. Okay, perfect. Now bring your knees up a hair so that you're more at a little bit more of a 90-degree angle. Keep coming, just a little bit more. There you go, keeping the hips stacked. Okay, so now from here, what I want you to do is kind of give that little exhale and perform that pelvic floor contraction. Some people call it a Kegel. And you're remembering to squeeze it together and pull it up towards the back of your pubic bone. You got it?
Yeah.
So you're going to hold that tight while you lift this knee up in the air. Good. And go back down. So something that happens a lot of times with this exercise is people get a little overzealous. Now, Janet, lift as high as you can. See how she rolls out of that stacked hip position? So that loses the effectiveness of the exercise. So go back to where you want to be, hips completely stacked. Now what I want you to do is lift that knee, but do not let this hip roll forward or roll backwards. Good. See how you can't lift very high? No. And now do you feel how much better that gets your muscles activated?
Oh, definitely.
Excellent. Okay, go back down. So when you do an exercise correctly, you're actually activating the right muscles better. So more lifting higher is not better at all. So we're going to do about 5 of these, okay? So each time I want you to remember to engage your pelvic floor and lift your leg up, not letting yourself roll backwards. Good, and back down. If you need to reset the pelvic floor in between, that's okay, to relax and engage again. Up. Don't let yourself roll back. It's hard. It's hard. Good, right there, good, and relax. If you can only lift a little at first, that's okay. That's a place to start, and you're gonna get better and better as you go. Make sure too to keep your feet together with this exercise. So you're not lifting the whole leg. Feet stays together, hips stay stacked. Lift that knee up only as far as you can without letting your hips roll back. This next exercise is a hip adduction exercise. So it works the muscles in between or in the middle of your thighs. And those muscles feed into the pelvic floor. So as you're getting those stronger, it also helps get the pelvic floor muscles strong. So what I'm going to have you do, Natalie, is bring your knees up so they're, right on the mat. Perfect. Okay. And so now I'm going to put the ball back between her knees. And you can kind of give it a little squeeze now, but you can actually keep it kind of relaxed. Just make sure the ball stays there. Okay, so what I want you to do is gently push your heels down into the mat and allow your pelvis to roll up off the ground. Good. Do you feel how your back gets nice and flat on the ground? Good. Go ahead and relax. Again, we're going to go through how you can do this wrong. So push your heels down hard and lift your back all the way up. Not correct. Okay, go back down. So it's just a very subtle motion in your pelvis. It's a rolling your pelvis up. Okay, does that feel okay? Mm-hmm. Okay, so what I'm going to have you do this time is give me a gentle exhale. And as you exhale, I want you to focus on bringing your pelvic floor together and squeezing together like you're trying to stop the flow of urine, and then pull up towards the back of your pubic bone. You got it? Kind of thinking about it in your head. Holding that, squeeze the ball, and you're going to hold those two things tight for 5 to 10 seconds. If you feel like you're losing it, it's getting too hard, stop, and that'll be your starting time. But for now, I know that you could probably hold for 10 seconds, so go ahead and hold. Good. Okay, and relax. Good. That feel okay? Yeah. So then you repeat that 10 times, and that's going to help strengthen those pelvic floor muscles and use some of the what are called accessory muscles to help activate the pelvic floor. So the adductor muscles between the thighs are your accessory muscles to the pelvic floor. This next exercise you might have seen a time or two if you've ever been in physical therapy for almost anything below or at the waist and down. It's called a glute bridge or a hip extension exercise. But it can also be really good for the pelvic floor because it's working on the whole core musculature. Okay, so what I want you to do, walk your feet just a hair away from your body. There you go. Okay, so what I want you to do, again, just like before, heels gently push into the floor and use that to roll your pelvis up. Keep your back down. keep your back down. So just roll up, perfect, okay? Now take a gentle exhale and feel your abdominal muscles come on board as well as your pelvic floor. You got that? Okay, so holding that tight, what I want you to do is now go ahead and lift yourself up off the mat, up into about the bottom of your shoulder blades. Good, and then go back down. Good. So while she's doing the exercise, she's staying in that pelvis rotated position and activating her pelvic floor at the same time. It might be hard at first for you to incorporate all of those things at once, but with practice, you'll get better and better. So let's go through it again. I'll coach you again. So go ahead and tilt your pelvis. Good. Give a big exhale. Activate those abdominal muscles. Activate that pelvic floor. Hold that nice and tight as you come up into a bridge. You feel your glutes activate and then go back down. Good. Let's do 3 more of those. You'd want to work up to a 10 of these. Good. One more and relax. Good. And if you lose that pelvic tilt, you can always just reset and, tilt again and go ahead and come back up. Okay, relax. Good job.